So the aim of this short session then is to look at first person on scene, basic and intermediate level, airway, suction and breathing management techniques. So we're going to start off with our primary survey first, as we always do. So we're going to check for danger, we're going to check for levels of response using AVPU, okay? We're going to look for any catastrophic bleeding, and we're going to deal with all those things before we get onto airway and breathing. So starting off with the airway then, first things first, you can see casualty is wearing a helmet, okay? It doesn't require a strategic removal, we can just remove it. So we're going to take off his helmet, place that to one side. And we're going to bring his head into a neutral alignment position. That neutral alignment's key as its nose, the centre of the chest, and the apex of the groin. Just puts less stress on the spine. So we're going to look straight inside the mouth to see if I can see any form of debris or obstruction. My first port of call would be to roll the casualty over, okay, if he's got any fluids, any debris in his mouth, first and foremost. Gravity is far better than using equipment. If I was concerned maybe that the casualty had got a neck injury and I was able to manage that, then what I would use then is suction. Or maybe if I couldn't quite get all of the obstruction out of this casualty's mouth, then I would elect to use suction as well. So going back to our course then, we would have used a form of suction. This is just one of the types of suction that we use on our first person on scene training courses, okay? So we've got a waist bag, we've got a little kind of puffer there, and then we've got the catheter, all right? So the catheter needs to be fully extended, and we're gonna have a look at the casualty's mouth. Now the catheter goes into the side of the casualty's mouth, ensuring it doesn't compromise our vision, okay? So it's going to go into the side of the casualty's mouth and only as far as we can physically see. What we don't want to do is put the catheter right down the back of the casualty's throat, thus then create a further obstruction hazard in the form of vomit. As we actually apply the suction, we're going to apply the suction for no more than 10 seconds as we actually withdraw the suction catheter. Once we're satisfied that the airway is then clear, we'll keep the suction close to hand just in case we require it again, and then we can move on to providing a basic airway for the patient. And we're going to do that first and foremost by providing a head tilt and chin lift. Now remember, we can use a jaw thrust obviously if we suspect a spinal injury. The problem with that though is as a lone responder, I would not be able to go any further because the jaw thrust actually requires me to remain in one locality. I'm then going to grab or use an oral pharyngeal airway. We've used these on the course, and the sizing technique does generally vary. However, we favour using the corner of the earlobe to the corner of the mouth as a measuring technique. Okay, so I'm just going to check that that sits correctly there, the base of the earlobe and the corner of the mouth, and I'm happy with that. And as we apply the oral pharyngeal airway, we're going to place that in inverted, and then we're going to slowly rotate that down into place and expose the chest as much as possible. Remember, in workplace PPE doesn't really aid vision that much. We want to get down to a base layer or even better skin, just so we can assess the quality of the casualty's breathing. So I'm going to look, listen and feel for no more than 10 seconds. You'll notice that I'm just checking the carotid pulse at the same time because the casualty is presenting unconscious. Okay, so the casualty's actually breathing at a rate of less than 10, and he has got a presence of a carotid pulse. So what we're going to do now is going to support that breathing with a bag valve mask. There's the mask. We're going to place that over the casualty's face, and we're going to use our C and E grip as you would have learnt on the course, maintaining an open airway at all times. The pressure needs to be across the whole mask to allow us then to get a good seal when we're using the bag and mask. Now when I'm ventilating the patient, what I'm aiming to do is just to see a small amount of chest rise and fall. And we're going to ventilate the patient once every 6 seconds, providing there is the presence of a carotid pulse. If we don't get active chest rise and fall, then we need to re-sight the mask, ensuring that it sits correctly, firmly and securely on the casualty's face. And just remember, these 3 fingers, we don't need to be grabbing hold of the windpipe or any soft tissues.